Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. And here we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, hello, hello. Happy Tuesday. My name is Abby Tyler. Welcome to my Tuesday show. How are you guys doing? Hope all is well. As you can see the title today is let me go back here and put that on because it doesn't say it there. It says Breast Cancer Awareness Month. So I will do that. Okay. Let's see. Okay. Alrighty. So breast cancer awareness. Are you at risk? Okay. So as always, my disclaimer, I am a provider, but I'm not your provider. So make sure you don't make any changes to your health regimen before speaking to your provider in this case, meaning your doctor or your NP or your PA, whoever you see as your primary care provider. Okay, so I'm going to get into the show in a few minutes. I appreciate if you guys share the show. Please share it to your various pages or to your group. I just have to share it to my group. I'm just gonna do this in 1 second here, and then we will be ready to go. Okay, so give me 1 minute here, and then we'll do that, and we'll be ready to go with the show. Okay, so and go in your group, and okay. Alrighty, so let's get into it there. As you all know, uh, October is Breast Cancer Awareness Month. Breast Cancer Awareness is every day. Okay, so but it's September. We just put more emphasis in October. We just put more emphasis to it. By the way, happy October to all of you. Happy birthday to everybody celebrating their birthday in the month of October. Okay, so breast cancer awareness, as we all know, most of us know somebody who has had breast cancer before, who unfortunately have passed away from it or is dealing with it, has been dealing with it over time. So as we get into this, most of my information is from my training again, getting it from the American Cancer Society, and I put my research together and all that. Okay, so let's start with some breast cancer stats. I usually, when I talk about statistics and all that, people seem so far removed from it because it's like, okay, is that this many people, that many people? They're not people that I know, so sometimes I try to make it back to where we need to know. So let's go to breast cancer statistics. This is from breastcancer.org, and this is breast cancer in the US. About 1 in 8 US women, about 13% would develop invasive breast cancer over the course of her lifetime. In 2022, an estimated 287,000 new cases of invasive breast cancer are expected to be diagnosed in women in the US, along with 51,000 new cases of non-invasive breast cancer. Okay, let me go in there. As of January, there are more than 3.8 million women with history of breast cancer in the U.S. This includes breast women currently being treated and women who have finished treatment. Breast cancer is the most commonly diagnosed cancer among American women. Okay, like I said, so to bring that down to where everybody needs to understand is most people are like, okay, like I said, okay, oh, what is like maybe there's 5 people over there, maybe somebody over there, maybe there's 12,000 people. This doesn't present to me. But again, I go back to the fact that all of us, every one of us, I'm sure that everybody knows somebody who has had breast cancer. We have a family member who has breast cancer or a close friend who have had breast cancer. And this is not just for older people. Like I said before, I was working where I worked before. I had 3 people who had breast cancer and they were all under the age of 40. So meaning age of 40, at that point, you're still seeing your period. So when you get breast cancer, when you're still seeing your period, your body working against the hormones and everything, that can even be, the outcome can be a little more poor from that, poorer than if you were older. But again, this goes into everything else. Again, talk to your doctor to look at your overall health history. Okay, so one thing here, a woman's risk of breast cancer nearly doubles if she has a first degree relative, mother, sister, daughter, who has been diagnosed with breast cancer. But again, there's a caveat: less than 15% of women who get breast cancer have a family history member that have, but 10% of them have no family history. We go back again, only 15% have that. Most people don't have any family history. So when somebody's saying, oh yeah, I don't have breast cancer in my family, I don't have this in my family, you can still get breast cancer and not have any family relation. It's just your risk of having that is high risk, that we say average risk, which everybody has risk of getting breast cancer, but higher risk if you have family member, first degree relatives that have breast cancer before. Okay, and that it also means it can be on your father's side and on your mother's side. Also, men can get breast cancer, but women, it's mostly on the women's side. And if a male has breast cancer or his mother have breast cancer, that's also your risk too. Okay. So we go back here and say so about 85% of breast cancer occurs in women who have no family history of breast cancer. These occur due to genetic mutations that happen as a result of the aging process and in life in general. So rather than inherited mutations. So again, like I said, I go back to put a point that you can still get it even if you have no family history. Okay, so what are the recommendations for getting mammogram? Okay, you can see my picture at the cover of the ad that I put on this for this show today. You see the mammogram there. Okay, so what do we recommend for those people who are getting mammogram? Women with average risk of breast cancer should undergo regular screening mammography starting at age 45. Okay, so if you're over 50, you haven't done it yet, get your breast cancer. So if you have any family member with it, and I'll go through the screening process. Women age 45 to 54 years of age should be screened annually, so yearly, every year. Just make sure. I usually kind of say, okay, this is the year, this is the month I'm going to get my a mammogram. I kind of do it closer to my birthday, but sometimes this is a little delayed. So, but I try to find a month that I remember. And now most of the facilities that do your breast cancer screening will remind you. They will send you a reminder letter couple of months before, and they also send you closer to the time. So they want to make sure, they also want to make sure that you do that. And if you see your family doctor yearly, they can follow up the time you were due for your breast cancer screening, and they send you, give you a mammogram, your script to go for your mammogram. Women greater than age 55 and older should transition to biannual, meaning like every 2 years screening, or have the opportunity to continue screening annually. Just because you get to 55 doesn't mean that, okay, if you have history of it, you would have to follow up with every month. Okay, so some other doctors might say, okay, now you're at this age, let's start every 2 years, depending on your medical history, of course. Okay, women should continue mammography as long as their overall health is good and they have a life expectancy of greater than 10 years. So let's say you're like 95 or something years old, then we're not going to be bothering to get a mammogram and all that, because your life expectancy, some people go on to be 120 years, so I'm not saying that. But if you're healthy, otherwise, they're not going to be putting you through all that to go through a mammogram for that. Okay, so here are some of the facts here. Okay, the thing about the differences about Black women, I'm going to say this very slowly. The fact that it used to be, most people used to say, okay, breast cancer is mostly, it was their disease, meaning that it didn't affect Black people that much and they could get away with it. But that is not true. Breast cancer affects Black women also. All right. We did have a lower incidence, but the gap has closed over the years. So what is most striking is that the mortality rates between the white and Black women have a 40% higher likelihood of dying from breast cancer than women of other races. For women under 40 or 50, the disparity is even greater. The mortality rate among young Black women is double that of young white women. One reason could be the higher likelihood of triple negative breast cancer, which is an aggressive form and resistant type that's always found in Black women. And also another contributor is delayed diagnosis and treatment, which is the result of persistent socioeconomic gaps and lack of access to quality for Black women. I talk about healthcare all the time. I talk about access to healthcare all the time. So again, that goes back to where you live. That goes back to who you're voting for. Are they the senators, your representatives? Are they putting money into increasing the health clinics where you live, the hospital? Are they giving funding to all the different places and all that? That's why when I talk about politics and healthcare closely intertwined. We all just went through the pandemic, and we saw how politics and healthcare closely intertwined. So I'm not yet to do a political speech, but as women, and we care about our health and advocating for our health, we also have to get involved in different political parties and all that, whether parties or just politics in general, just to make sure that you're getting the best of health, not just for you, but your daughters and your sisters and other people that are coming after you. Okay. So, what are some of the risk factors? The risk factor, just being a woman is a risk factor, but who are at a higher risk? Again, like I said, that. So, being a female, women are much more likely to get develop breast cancer than men. We know men can get breast cancer. Beyonce's father had breast cancer. Other, I'm just sort of like a famous person, so people would know that. People have had men can get breast cancer. So you're supposed to be checking too. Increasing the age. If you get older, your risk for breast cancer increases. Okay, a personal history of breast cancer. So if you had breast cancer where you had what the cancer developed in your milk ducts, you breastfeed a baby in that area, anatomy there, you have a higher chance of getting that. A personal history, also a family history of breast cancer. If your mother, sister, again, like I said, a mother, sister, daughter diagnosed with breast cancer, particularly at a young age. Okay, so again, going back prior to menopause where you stop seeing your period, you have a risk of breast cancer increase. So the majority of people, again, who develop breast cancer have no family history of it. Inherited genes. Everybody, I don't know if you guys know Angelina Jolie. She was the first one then when she had breast cancer, and she had the BRCA genes, the BRCA, that's BRCA gene 1 and 2. Some people will have the breast cancer and it runs in certain ethnic groups. It can run in all ethnic groups. So if your family member had that and you see like a mother or a sibling or her sister to have it, you want to be tested for that, because that means that runs in your family. And people who have that gene also have a higher chance of having gynecological cancer, which is your ovaries and your uterus and all that too. So they have to run the test and see. And if you have that gene, you and your doctor can sit down and talk about different options. Okay. Those who have had radiation therapy in the past, like I said, if you had any kind of chemotherapy or anything done to your chest area, you have a higher chance of getting that. If you began your period at a younger age, begin your period before age 12. I talked about how to have the talk with your daughters. Some girls go through that period at age 9. Some get it as early as age 8. So that's one of the chances. Those are some of the things that you have no control over. Okay, so if you had your period before age 12, what can you do about it? Okay, but it's just that one of the factors that put you at risk. Okay, so beginning your period before age 12 and your menopause increases. So if you had the menopause, if you're seeing your period way after age 55 and all that, that can also, because you still have the hormones in your body. All right. And if you begin your menopause, like I said, older age, having your first child at an older age, because you're not secreting the breast milk and all these different things like that. The research on why this and that, and when they do over a while, then they have to pinpoint the reasons. Those are some of the reasons. Doesn't mean this is ironclad. This is not comprehensive. So this is introductory information. Okay, and have never been pregnant. So women who have never been pregnant have a greater risk of breast cancer than do women who have, they have more pregnancies, because I guess that goes with the female hormones also. All right. So we will go into postmenopausal therapy. Those who, when you go into menopause, you go into hot flashes, there's so many things that come along with menopause. And menopause, again, I'm going to say, that's when you stop seeing your period for a whole year. Okay, you could say, oh, I'm going to menopause and I didn't see my period last month and I saw it. And if you're sexually active, you can get pregnant. So you want to make sure menopause is complete, consecutive 12 months. So some people have a lot of problems going through menopause. They have problems with severe hot flashes, and people think, okay, what about hot flashes and this? Hot flashes feels like when you're sitting there, when you're getting sick. And this is all for women stuff. And even men, are you listening? This is all family, because people think breast cancer just has to do with women. If your wife has breast cancer, your mother has breast cancer, it affects the entire family. Okay. And also extending members of the family. So when you're going through hot flashes, it's like you're sitting there, and when you're getting sick, it takes a little while for you to have a fever. Well, when you're having hot flashes, it seems like all of a sudden your body just turns on the heat, and it just like completely sent you to a point where your body's like overheating, and it stays there for a couple of minutes until you finally cool down. And when you cool down, you're very cold. So going through that, some women, they don't have it really extensively, but it can be very very hard to manage, and it can really cause anxiety and restlessness and everything else that comes along with menopause. So some women have to get postmenopausal hormone therapy. Some doctors will put them on the therapy, so okay, this can kind of control that for a couple of years. If you're on there, you don't want to be on there for more more than 3 years, or if you no longer have the feeling and you can manage the feelings without it, the symptoms without it, don't be on it for too long, because that can also expose you to breast cancer. So if you are on hormone therapy, ask your doctor, how long should I be on this? It shouldn't be no longer than 3 months, 3 years, or shorter than that. If you have a risk factors that you have family member that had breast cancer before, close family members, talk to your doctor about it, because if they're putting you on that, they're going to be asking you that. And if they don't ask you that, make sure you volunteer that information, because you're not supposed to be on it. Okay, they can find other natural methods to go by. And drinking alcohol. Okay, drinking alcohol increases the risk of breast cancer. If you have dense breasts, a lot of women have dense breasts. That means like the particle in your breast is so tightly together that the regular mammogram, when you have a mammogram, let's say you have your mammogram this year, and it tells you, oh, I'm fine. Is negative. Okay, because the mammogram cannot see right through it completely. So they're going to tell you that it is negative. So you can be negative until the breast cancer becomes, clearer for them to see, and the mammogram picks it up. And unfortunately for some people, it's too late. It's already far gone. So usually if you have risk factors, let's say your mother or father had risk, I usually, when I send my patients for their mammogram, I read the prescription. I said with ultrasound to follow. You do the screening mammogram, we do diagnostic mammogram with ultrasound to follow, because at least that way you have the mammogram with the ultrasound to follow, to make sure that we're catching everything before it gets to the point where, okay, now you have cancer. So annually, and then if they tell you, make sure you come back, Okay. So they also at one point in the 50s, 1940s, 1970s. So I'll be talking to women who were pregnant around that time. They were giving some medication that was supposed to help with prevent miscarriage, and a lot of those women develop, and eventually it developed breast cancer. That is off the market now. So if you were given those medications during that time, you have a higher risk of getting breast cancer. Again, like I said, those would be women now who are like in the maybe 60s and 70s. So 60s, 70s, 80s. So, and if you live, some medications are off the market in America, and sometimes they're still in the market somewhere else. So those medications, talk to your doctor about that. You should be getting that. Okay, so let me get in here. I'm just in between everything. I'm getting to the symptoms. I'm just gonna take a quick look here and see. Okay, so Edward said sad disease. Edward, hi Edward, how are you? Hey Abby, what's the rate of breast cancer in Liberia? I didn't do the one about rate of breast cancer in Liberia. I guess you have to ask the health department over there. I just did the one for US, and then they have the one worldwide. But you can go on cdc.org and get there. They have the worldwide stuff and all. And let me see. Then it said, didn't know men can have breast cancer too? What about the breast cancer that makes it susceptible? I guess the glands in your breast, and some because you don't have as much as the woman, but people have that. You have milk, that you have some hormones from your mother too, so that goes on from there. But it's just been discovered, and they're doing more studies on breast cancer in men. So hopefully in the next couple of years we'll have more. The incidence is really low, but it's there. So the research is ongoing. So hopefully by then we'll have more information about that. But just the breast tissue. So for men, you always have to have an ultrasound, because your breast cannot go into the mammogram machine. Okay, so but just keep an eye on that. I'm going to go through the breast cancer, the breast demonstration in a few minutes. Okay, so going back to now to symptoms. So you say, okay, so what to watch out for if you have any, you think you also you say, okay, Abby, what am I supposed to look for if I think I have breast cancer? Sometimes there are no symptoms at all. Okay, when I had my when I had issues, when I was having chest pain, I was talking to one of the doctors that I worked with way back then. She's like, okay, well, go check for it to make sure you don't have asthma. And then let's make sure we do cardiac testing and all that. Do your EKG, echocardiogram, and do all these other testing to make sure there's nothing going on in your heart. And then also get a mammogram. I'm not in my 30s at the time. I said, oh my goodness, and again, like I told you guys, there are certain diseases and symptoms can mimic some different kind of diseases. So you can say, what his doctor doesn't know what she's talking about. No, we have to rule certain things out first. So I went ahead, and the echocardiogram was fine. I went ahead, did the I didn't have asthma, so I had to go ahead and get my mammogram first, get the mammogram, and then they said, we see something there, come back and get it, get the mammogram. Oh my goodness, come back and see. And then it's like, because they usually have they didn't have anything else to compare it to. And then because of that, so I will get into that some more. So what to look for? Okay, I didn't feel like, again, I didn't feel anything. All right, so there's any new lump in your breast or in your armpits. Okay, if you're feeling there's any lumps there. Now, lump doesn't necessarily mean that you have cancer. It just means that you have to get it checked. And we don't always biopsy everything, because every time you don't want to keep exposing the breast to everything else that doesn't have to be exposed to. So they have to, again, go through your whole family history and do that. Okay, any thickening or swelling in any part of your breast. You look at your breast and you see your breast, like if you can tell you when you know you're like your breast is full when you on your period or around that time, or you're pregnant. But if it seems like much fuller and swelling, it's more different size, like a bigger than it normally is, keep an eye on that. Not around the period, because again, like I said, it's going to be a little more swollen around the time of your period. Any kind of irritation or dimpling, if you see any dimples in your breast and all that wasn't there before, that's one of the signs. Any kind of redness in black skin is going to be a little darker than your natural color, or any flaking in the nipple area. Keep an eye on that. Any kind of pulling of the nipple or any pain in the nipple area. You're not supposed to have pain there. I mean, you'll be a little sensitive around the time your period or if you're pregnant and all. But if it's really painful, bring that to your doctor's attention. Any kind of discharge, if you're not breastfeeding, if you haven't really recently been breastfeeding, any kind of discharge, you want to bring that to your doctor's attention. Especially if it's blood. Okay, if there's any kind of blood, breast milk when you're not breastfeeding, not like say, okay, you just didn't breastfeed a baby today. If you haven't just had a baby and you're breastfeeding and you're putting out milk and all that, and there's any blood, okay, you want to be like calling the doctor's office tomorrow and say, I want to come in. Okay. And any change in the size and the shape of your breast. Now, as you get older, some people get, as you get bigger breasts. As you get older, sometimes your breasts get smaller after you have babies and all that, and you lose the density in your breast, or you lose the, everything, the fat in your breast. So that's different. But you start seeing differently, and some women, each breast is not the same size. If you start noticing anything different from the norm, that's why I tell people, I say every day you go into the bathroom to go get washed, even once a week, just sit there, take your clothes off, and just look into the mirror completely naked. You're not just looking at your breast, you're looking at everything around here, and you're also looking at your full body. Looking your full body, making sure there's no different discoloration in there. Turn around, look at your body and everything. Do your own body assessment at least every month, so that at least if you see something different, you can bring that to your doctor's attention. Okay. And any kind of pain in the breast too, you want to bring that to. So these are the red flags, okay? And then breast puckering, like you see your nipples like different shape and all that, bring it to your doctor's attention. Swelling, we talk about the redness, we're talking about the darkening of the breast. Inflammatory and breast cancer is an aggressive form of breast cancer that can present with symptoms that would mimic an infection. Because we had a patient before, what she thought she had little sores and everything on her breast, and she said, "Oh, I was home, I was just sitting there, and I thought I had, like, bro, we'll call that rossing or something." And you saying that she said, I was just putting, warm compress and putting stuff in there every day. It was draining. So I did thought I had a little sore there, and sadly, by the time she came to us, it was too late. Okay, my throat's getting dry. Excuse me. So I want to do that. So again, like I said, Black women are 70 times more likely to develop invasive breast cancer than white women. If you experience any pulling, swelling, or redness in the breast, contact your doctor immediately to avoid life-threatening complications. Okay. So itching, rash, and breast pain after menopause. If you no longer see your period, you're not supposed to be having any kind of breast pain. If you have any breast pain after your period, bring it to doctor's attention. It's rare, but it's also it's like an early sign of breast cancer. So you're saying, okay, so we know that I've talked about the risk factors, and those are not, and again, it's not conclusive. The risk factors, I talked about the symptoms to look for. And again, sometimes there can be no symptoms at all. Okay. So you say, oh, how do I do a breast examination? So usually usually we tell people that to tell women, if you're going to do your breast exam, it doesn't matter how young you are, you can still be doing this by the time, even as a teenager. But don't get to, when you're younger like that, we just kind of teach people ahead of time, so as they get older, they know how to do it. Because you can still get breast cancer in your 20s. You can have other things go on in your breast that is not cancerous, but that needs to be checked by a doctor. Okay, so we tell people, okay, if you're gonna do your breast, you do your breast examination every month. It's not 100% effective and all that, but usually most people, when they develop breast cancer, it's usually they come into the office and we find out from that. Okay, or then we do the menopause, we'll do the mammogram to confirm it. So you're gonna do your breast examination. You want to make sure you're doing that a week after your period, because that means your hormones will be down, the swelling from your period and everything will be down and all that, because your hormones overacting, getting ready to for the body to get ready to have a baby. And when you don't have a baby, the hormones and everything is released from your body, and everything is go down. It goes down until the next month. All right. So if that's not going on, you make sure after a week your period, you want to do that. You check your breast. So let me demonstrate for you. All right. So in order for me to do this, I'm gonna have to like take my blouse off. Yeah. Okay. Anyways, just wanted to make sure everybody was watching there and listening. Okay. So this is what you do. And if I'm doing this on my patients, usually they're laying in position and they got their arms over their head. So if you're gonna do this yourself, you can do this. You can do this standing up. You put your arms completely. You put your arm over your head like that, and you do. Okay. So this is in the way here. Okay. So you come over and you're going to be going around. You're going to go outside here, all the way around your fingers, just use your fingers, and you're going to be touching, going like that, go all the way around, all the way to the perimeter of your breast, go all the way there, pressing, pressing, pressing. You're pressing hard because you want to be feeling it's going to be like a tiny little dot. You go in the way around, go all the way around, do that, touch, complete the touch. When you come to your nipple, you're going to get your nipple there and you're going to squeeze. You just turn it this way, and you're not going to be squeezing until you see blood. You're going to be squeezing just a little bit and making sure nothing's there. And you're going to go all under your arm too, because you have breast tissue all under your arm. Okay, so you're going to start it clockwise, go all the way there, go away around. You do that. You can do that standing up while you're in the mirror. You can also do that laying down too, because if you laying down, your breast will be a little flatter, and you can reach and make sure you're doing around the breast, Do that with your fingers. Okay, so you're going like that. And then you get to your nipple again, squeeze. So if you're a patient in my office, I'll be doing that, going like around, and then squeeze and make sure. And then when, that's fine. Sometimes if you do feel a lump, don't get scared, feel it and make sure, you can say, okay, I feel a lump. What am I supposed to do now? Again, sometimes you can feel something that is not cancerous, but you want to get that checked. Okay. So you get in there, you go to your doctor's office. These are some of the questions we're going to ask you. So when did you first notice the lump? Okay, because we want to get a time there to make sure that it hasn't been far gone. All right, is the lump in one breast or both breasts? Because sometimes it's like when younger people come in there and they're like, okay, I feel this here. So we want to make sure if it's uniform, if it's here and there, then it's probably not that, but we want to make sure, because you can get it in both breasts at the same time. Can you feel the lump in your breast when you change position? Like if you're laying down, do you feel it when you're standing up? Because if it's moving around, and chances are it's not the breast cancer lump, okay? That means mobile is moving. If it's fixed in one spot, then we start getting concerned. We'll still get concerned also, but we're asking these questions. Is the lump hard? Is it tender? Is it firm? Like if you press down like this, is it still there? You feel it there? Like if you have a bump, or like a razor, stuff like that. A pimple, it'd be harder, like hard pimple. Does it feel that way? Is it on your armpit? Is it near the breast? Is your breast swelling? Is the lumping, the one thing you have that you felt there, was that close around to your period? Did you feel it the following month and it was stay at the same place? Again, like I said, your hormones kind of work along with your breast. If you make you a little swollen, and you can have some lumps here and there because you're on your period. So that could be normal. So we're going to ask you all those things to get a proper diagnosis. Have you experienced any associated symptoms like breast pain, fever, unexplained weight loss? Because you could have all those, you could have none of those symptoms, but then you start having weight loss. People say, oh, at first when it starts, they tell you, oh my God, you're looking good. You okay there. Then next thing you know, it's like, okay, you're losing too much weight. Are you okay? You're losing too much. And you're not trying to lose the weight, but you're losing the weight. You start having stomach pain. You don't have any desire to eat, and other things will show up. All right. Do you have any personal family history of personal or family history of breast cancer? Have you had any breast cancer in the past? Did anybody ever tell you before when you were younger that you had to come back and get a mammogram? And also, do you, especially family history, do you have any history of BRCA genes? The BRCA genes, BRCA is what I'm talking about, okay? BRCA, we just call it BRCA gene, BRCA 1 and 2. So again, talk to your mother, talk to your sister, talk to your family, talk to your grandmother. I know certain things in our families, and depending on the culture that you're from, nobody talks about different things. Oh my God, it's like, oh, you had this, or you had that's a big shame, and nobody wants to talk about it. from our Liberian culture. There's this girl. She's a former classmate of mine. Her name is May Makamo. You can look for her on Facebook. She had breast cancer, like really invasive breast cancer, I think at like age 33. And so since then she had made that her life work to make sure she teach the public about breast cancer. So she's on Facebook. You can look her. She's got the organization called Tiger Lily. Tiger Lily. So it's just Mema Kamo. Just look for her on Facebook or Google her name. She's got so much information for the past, I think, 20 years now. She's been teaching everybody. She's been on so many different talk shows and all that. So she started talking about it. She had no family history of it at the time. So you can say, okay, well, and I thought this was like old people. Again, like I said, as you grow up, as you get older, your risk increases, but you can still get it when you're younger. And if you get it when you're younger, premenopausal, your body's working with your hormones, that can become even more complicated. Okay. So now you're saying how can this be diagnosed? Again, we usually go for the screening mammography, like I said, when you're supposed to go for your mammogram. I'm not going to lie to you. The first time you get a mammogram, because they're taking your breast and they're putting it in the plate and they're squeezing, and they squeeze really hard, really, really hard. They tell you to hold your breath. So they squeeze really hard. After the first couple of times, you don't feel it, you feel it, but it's not as painful. And just the first maybe 10 minutes discomfort, because they have to do that, and they have to put your arm over it, and they have to squeeze it down this way and squeeze it different directions and squeeze it in and all. After a period of time, you can say, okay, my God, I don't want to do that. 5 minutes to 10 minutes of discomfort could save your life. So don't say you don't want to do that. Okay. So we'll start off with the screening mammogram, which is what everybody gets at the beginning when they start getting at age 45 or age 40, depending on your history. And then we go on to, again, like I said, I order ultrasound for people who are higher risk, as they follow up the ultrasound. And then also we didn't do diagnostic mammogram, because if we see something else, they might tell you, come back in 6 months. You get a paper that's saying it's negative, or they tell you they need more mil films. Then we get another letter that's telling us. So also to tell you dense breasts. Okay, again, like I said, the particles in your breast are so closely together, so the mammogram machine itself cannot see it. So they'll tell you that that's a normal thing, but it's always a disclaimer when you have your mammogram and they send that to you. The radiologist will tell you dense breast is common around, but at the same time, we're letting you know that this is not 100%. The mammogram is not 100%. So make sure you also doing your breast exam and also follow up every year, like we told you to. And if a family member during that time finds out, let's say your sister or your mother was diagnosed with breast cancer, bring that to your doctor's attention. Say, yes, I know I did my mammogram the last time, and I didn't have anything going on, but I just found out that my family member had breast cancer. A mother or sister got breast cancer, so I want to get checked again. So then that's when we can do diagnostic ultrasound. There's so many different diagnostic breast mammogram, and followed by ultrasound. And then we can do that, and then we'll send you to the oncologist. So they can, or the breast surgeon, and your gynecologist will be working along with you too anyway. So that's why it's important that you follow up with your gynecologist schedule every year, and also every 3 years, depending on your medical history. And then they can go and say, okay, we need to do something more. So like I said, for me, I didn't feel anything. Okay, I went there. I was like, okay, did all the different stuff and all. I didn't feel anything. When I did my mammogram, they said, come back. We need to get checked. Now, if you're in this field, you're thinking, oh my goodness, they want me to come back. Something's wrong. And I did it, and it said, okay, we still want you to come back. Something's wrong. And then it's like, okay, I'm like, okay. And they say, something there that we can't really tell what it is. And we just want to make sure that it's fine. Okay. You have to come in. We don't feel comfortable just saying that's okay. You have to get a biopsy. So when you start hearing all those things, and or you have all the knowledge, your mind start going every which way and all. So I went ahead. I had to do the needle biopsy, where they just stick the needle, and you do that in anesthesia to go in there, and they take it and they send it to the lab. The lab tests it, and of course they're like, oh, we want you to come back again, because we're not too sure. We can't say A or B, so we want you to come back. So I had to go back again, and where they had to go to the incision, where they opened up a little bit, took out a little bit of breast tissue. Okay. And then they sent it to the lab, and I was scared. Okay. Because I was still like about, 30 something years old at the time. So I was really scared. And luckily for me, it was negative. Okay, it was like, okay, it's negative. So because of that, I've been having a mammogram every year since I was in my 30s. Okay, there were times where it was scary. It was like, okay, you need to come back. Okay, you need to come back and do the ultrasound. So every year I go and get my mammogram, and then it's like followed by ultrasound if needed. So they'll read the mammogram, the radiologist will read it right there, and then I'll be sitting there waiting, and just like I said, please don't let me have to go for ultrasound this year. Please don't let me go for ultrasound. And every year they'd be like, Miss Tyler, I want you to go ahead ultrasound. So it's like, okay, you saw something again. Okay, so you take you there, we go to ultrasound, and then you wait. Now, if you because you have mind chart, so you get the results literally 24 hours later on your phone. So, and sometimes I don't like that, even when I send my patients to get their mammogram too, because it's like when they see something, they're so nervous. I think we should get the results first before the patient gets the results. But some things are different now. So you get your results and then follow up. And it'll tell you follow up in 6 months, follow up in 3 months, because sometimes the radiologist might see something and they can't say for sure. So they might say, we need your close follow up in 3 months of us. So please go. I know sometimes it can be scary. Trust me, as health professionals, I who order mammograms now, is scary too. So please go. To go and get your mammogram, they'll tell you the day before your mammogram, make sure you get there on time, make sure you get at least 15 minutes. So I usually go early in the morning because you can't have any lotion on you. You're going to have any deodorant on you. So you have to go and get yourself there. So go there first in the morning, get your mammogram, and then go on and go to what you have to do for the rest of the day. Okay. But you go in the dark room, you go in there. It's always, I've never had a male person there. It's always like a female working there. I can't say for sure that's the person, but you can also say you want a female technician if that's what you desire. They will work harder, but it's usually like a female. So just so make sure, and then they go there and going from there. For me, it doesn't really matter because my GYN is also male. So, and then the surgeon that was working on me when I used to be doing all that, he was my coworker also. So there were days where I would go to him and then I come back and the next day we see each other at work and it's like, oh yeah, how you doing? How you doing, Abigail? And then yes, you saw my breast yesterday, but today we're working together. So that's some of the things when you're in healthcare, most of the people who'll be seeing you will be people who you work with. So, because the people who to go to. So that's why. So your diagnosis, you do that once a year. And then if they tell you to come back, please come back. Okay. So there are also, if you have some of the things what you can do, the prevention, okay, these are not, sure things. These are just some of the things you can do. There's some modifiables. There's some things that are modifiables. There's things that are non-modifiables. If you see your period before age 12, there's nothing you can do about that. If you decide not to have any children, I can't punish you because that's the reason why this happened, because even if you have children you can still have breast cancer. So there's no one sure way, but these are the things that you can do. Make sure you ask your doctor about your breast cancer screening. If your doctor doesn't bring it up, we're supposed to tell you anyways, because that's the quality core measures. We're supposed to tell everybody age 45, and when you come in as a new patient, we ask you about your medical history and all. Okay, so discuss the doctor when you're supposed to be starting your screening and your clinical breast exam and also your mammogram. Talk to your doctor about the benefits. Your doctor will explain to you the risks and everything involved. Become familiar with your breast through your breast exam. Again, like I said, get yourself naked, look at your breast, do it what you have to do. Don't just go like that. Okay, that's not, you're not doing anything. Get your fingers, go around clockwise and everything. If you need to come counterclockwise, and do that. Okay. Drink alcohol in moderation, or don't drink alcohol at all. But if you have to drink, don't do it as something where you're going to have a problem with. All right. Exercise most day of the week. I know for some of us, it's very hard to do that. Try to walk. Even if you can just go for a walk every day, go for a walk every day, 30 minutes a day, 3 days a week. Go ahead and do that. Try to stay fit, do upper body exercise. All right. Again, limit your postmenopausal hormone therapy. Like I said, okay, when you have people who have really bad menopausal symptoms, you want to talk to your doctor about that. If they're going to put you on it for as long you take it for, it shouldn't be no more than 3 years. And again, I said, do it for the shortest amount of time, this lowest dose for the shortest amount of time. If it's helping you over 3 months, and you can stop doing it. But if you have a higher risk of getting breast cancer, again, like your family member or something else, a personal history in the past, then I would suggest that you don't take it. Again, there are many options. Speak to your primary care doctor and speak to your gynecologist about it. Again, because like I said, menopause can really be a bother for some people. It really, you staying from home from work, and at that age you have older children, you're still working, you want to live your life. So of course you want to help with those symptoms, but at the same time you don't want to put yourself at risk for anything else. Okay, maintain a healthy weight. I tell people, like, try as much as possible, exercise, try to get you're not going to be the same way you were when you were 21 years old, when you're 25 years old, when you had no children before, and your body was just, you could eat anything and lose everything overnight. Okay, maintain a healthy weight. I'm not saying to be skinny, skinny, skinny. If you're skinny, 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 that's good. That's good for you. Some people are skinny forever. Some people are chubby from the time they were little. Just maintain a healthy weight. Watch your cholesterol level. Speak to your doctor about your A1C, your diabetes. I'm going to be talking about diabetes later. Diabetes, look at your A1C, look at your cholesterol level, your kidneys, and all. Try to keep healthy. So not just on the outside, but your healthy inside as well. Okay. If you lose weight, you can your doctor. There's so many options that you can lose weight that is less complicated. And like, again, you want to get up and you want to get moving every day. Okay. And choose a healthy diet instead of Mediterranean diet. But even with the food that we eat, most of us eat rice and everything, rice. Cut back on the rice. You can eat brown rice. You can eat don't eat rice every time. Every 5, 6, 7 days a week. Some people eat rice 2 to 3 times a day. That's too much. If you eat pasta, if you eat other stuff, you eat pasta, so all this thing is like heavy carbohydrates. Eat a lot of fruits and vegetables because it has fiber in there. It can get all that gunk out of you. Try to eat some salad if you can, because some people don't like salad. You can eat some salad, eat healthy stuff, and stay active. Go out with your kids, go hang out with kids, play basketball, do anything that's going to keep the body going and keep the heart functioning. What I do too, some of the things I do when I shave under my arm, I shave at night. If I take my shower at night, I shave at night, and I don't put any roll on. After I shave, I don't pull any roll on until the next morning, because when you shave, you have little microscopic openings there. You don't want any of that and any of the roll-on deodorant going in there, because they're saying, okay, so you're saying there's something wrong with it? No, because the roll-on deodorant is there to make sure that they'll keep you from sweating. So when it's keeping you from sweating, keeping all that in. So I don't put any roll-on on me. I don't put any roll-on the night. What I do, I put some powder on me and all that, so I don't have body odor at night. But I make sure I don't put any roll-on on. And then when I shave, make sure I shave at night. I don't put any roll-on on until in the morning either, because that's why I don't shave in the morning. Because if you shave in the morning, you take a shower, you shave in the morning, you have to put roll-on on before going out. So I don't put any roll-on in the morning. I don't put any lotion or anything of those different things. I try to keep any kind of perfume or anything that doesn't have to be under my arm. I try to wear bras that don't have too many, that don't have like the underwire in there. And if you have bras that don't fit, make sure you get them fitted, because you don't want anything digging into your skin. That's your lymph nodes underneath there. So you want that to breathe. I don't sleep with my bra on. Okay. So some people like to wear their bra because don't know, that's in case you have like heavy breasts or things like that. You want to keep it up, but don't wear your bra at night. The person who you're sleeping with, okay, husband, boyfriend, whoever it is, and all that too, they have to understand. No, you don't have to wear a bra at night. You want you want everything to breathe, right? So those are some of the things I do. That's some things I do for myself. Okay. And they have natural deodorants out there too. They had somebody who had a natural deodorants, but I was like, honey, just put a little bit more in there. Okay. Because the natural thing was not working. It just smelled really bad. So for some people, they want to use something natural, so they, not exposing themselves to that. So that's that's good. For those of you who have like higher risk, okay, the preventative medications, let's say your family member had it, with the preventative medications you can take. And also if you have a family member that had aggressive breast cancer, and you can literally have a mastectomy, preventative mastectomy. That's what Angelina Jolie did. She went ahead and they took out all her breasts, all the breast tissue and everything. Usually if you do that, the insurance company will pay for reconstruction, because they always say if you went in with 2, or you should come back with 2. So you have your reconstruction. I know some people will say, oh, you had, who cares? You at least you don't have breast cancer, so you worry about it not having breast. No, that's also an image thing. For a woman, I don't care how sick you are, whatever it is, you want to feel good about yourself. Whether your breasts were big or whether it was small, whatever, you want to feel that. That's all part of being a woman. Okay, so now there's some people who don't mind having no breasts and they just flat there. That's fine with them. But some people who want to do that. So in that case, the insurance company would pay. But check with your insurance first. So you can have preventative mastectomy to take everything up and get yourself in use of the boobs. Okay, so for there, and also for cost. All right, their mammogram can be expensive, can be pretty pricey. Some insurance company would pay for it because it's like preventative. They would pay for it. Even if you have like really bad insurance, they would pay for your annual screening. Okay, they'll pay for your family, your to see your family doctor, to see your GYN, and then anything specialist and all that. Then that's where that gets a little pricey. But there's so many ways of getting free mammogram or free or affordable mammograms, so you can go to Planned Parenthood. Okay, so for people who have issues with Planned Parenthood and everything else, I'm talking about breast cancer right now. Okay, go to Planned Parenthood. You can go to your local cancer centers in the area. You can call them. Okay, there's SusanGColeman.org. You can call them. Ask your OBGYN. Most OBGYN's office, the obstetric and gynecologist. You can ask them, and they have most of them have connections with the free or affordable breast mammogram in the area. There shouldn't be no reason why a woman should be dying because she couldn't afford a mammogram. Okay, actually local hospitals too, because most of those hospitals have places where they can send people to who can afford it. All right, your insurance company can also help you. Okay, they will tell you where to go for it and where it can get low cost and get some money. You can pay some money out of pocket, but also they can also help you with not getting it. Again, like I say, your screening mammogram, they should be paying for it. If you don't have insurance, you can also call these people. Breast cancer, you can go to breastcancer.org. American Cancer Society, you can check with them. Again, like I said, May Makamo, she's on Facebook here. She does this Tiger Lily. She has this Tiger Lily Association where she talks about breast cancer, and she has all these different resources that she can help people. So you can look her up on Facebook. Her name is spelled Maimah, and it's last name is Karmoh. By the way, she was my classmate way back in the day. Okay, so if you're out there, hi Maimah, you've been doing a great job. I've been following over the years. Okay, so as you're saying, we do that. You'll be like, oh, what other way can we help to? We can also help by donating to these organizations that I talked about, because you help. It's almost like paying it forward and knocking wood that you never get to the point that you may need it, but it's paying it forward, and you're also helping out people who can afford it. I mean, these companies, also these organizations, also help people overseas as well. So you helping somebody who really needs it, somebody's mother, somebody's daughter, somebody's wife, your family member, because we have family members where there's some family members that are really rich and some family members that are poor, some people that are in between and they may not be able to afford that. So you helping people out there. Okay, and you also helping to research, because the more and more research that come out over the years, that's what's helping more people not to die from breast cancer anymore, because as the research goes on, people can get tested early, get screened early, and get the information out there, so that way they can live a better and healthier life, so they can be spending more time with their family members. Okay, so basically, again, like I said, her name is May Makamo. She's our own librarian person, so I'm just giving a shout out to her. But there's so many other places that you look, and then also ask your primary care provider. Also, they can help you with that. All right. So thank you all for watching. Okay. I appreciate those who have watched today now with me, and those of you who will be watching. So if you like this video, if it has been informative, please, 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 whatever you do, please, I'm just begging you. Can you please just share the video so other people can see it? Many other shows will be talking about breast cancer this month. Okay. And I don't care where you get your information from, just as long as you get it, but you want to be getting it from reputable sources. Okay. If that person's coming on and talking about this and they're not giving you information that sounds like they just bring you information and it sounds like they're making it up, please, the best place you can get the information from would be from your doctor. Again, like I said, my disclaimer over here, this is informational purposes, but this is all evidence-based, because I also prescribe. I also have to write for mammogram. I also have to explain the results to people and all that. And also my history and being a woman too, having a daughter, I want to make sure I'm keep myself safe and make sure it's okay when my daughter gets there, and my siblings and my female cousins and all that. Okay, so please give me a thumbs up if you love this video. I don't see any other questions there. If you haven't liked or followed so far, please like and follow so you don't miss any turn on the notifications so you don't miss anything. All right, so let me see here. Any question? Jackie Jackson, can you do a part 2 of this topic, please? I will try, but I did almost like an hour of this. If you have anything that you want us to talk about later on, we can do that. Steve, oh my goodness, look at my big sis. Stevie, thank you. Stevie said, great job, Abby. Oh, Stevie, how you doing? My almost family. If you know, you know. You know, those people say, if you know, you know. But anyways, thank you all for watching. I hope you can go back and read that again. Again, is my hope that everybody, every woman, I talk about the screening, get your mammogram, get your breast checked, take off your clothes once a week, look at your body. You're not just looking at your breast, looking at everything else, and bring to your doctor's attention if you notice anything. So go back and watch this video, and please give me a thumbs up. Please, please, please like and follow, like and follow, like and follow. Thank you all for watching. If you're watching on Focus on Liberia, on Abby Tyler's Healthy Living, or on YouTube, I say thank you. And let me just see, Jackie said, just given this is the month of this topic. Okay, I'll talk more about it because I also have other things to talk about, but I'll look into that. And James said, was to come back with more information on male breast cancer. Oh, you know what? Yes. Okay. Alrighty. Yes. Yes. I can do that because I mean, look at Beyonce's father, and he was, and many other men. So I'll look into that. All right. And I have more information. I'll bring it up. I promise to bring that up. Okay. So just remind me if I forget. Thank you. Thank you very much, James. Okay. So thank you all for watching. Please hit a thumbs up, like button, hit the like button there. Okay. So at least that way, and then other people can see it. And again, my friends may not be your friends on Facebook. So please share the video as much as you can. Please share the video as much as you can. And let me see there. Thank you there. Okay. So thank you all for watching. And I wish you all a good night. Stay safe, stay safe, stay safe, get tested so you can be around for a very, very long time. Okay. And healthy and healthy, healthy and happy. So good luck. Good night. Thank you all for watching.